Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Over the past few years, there's been an awareness of physicians, especially urologists, that men present a unique population of patients. Much like women, when they're in their teenage years, start to see a gynecologist for very specific issues, there are problems that are very germane to men and are probably best handled by a urologist.
What age groups would fall under men's health?
A men's health program should involve any male from puberty on into, the last decades of life.
What are some basic healthy things that men can do?
An awareness of testis cancer is very important. Over the past decade or two, there's been an effort to have men examine their testes monthly, much like women and self-breast examinations, and to identify if there is a problem to bring it to the attention of their doctor. Men who have infertility issues or have erectile dysfunction issues should see their doctor and report that, because that can be a sign of many different types of illnesses. And obviously, if men have problems urinating or blood in the urine, these are things that usually scare them enough that they'll come to the urologist and see us.
How important is it for men to regularly see their doctor?
A problem physicians always have with male patients is that men do tend to see doctors less, especially when they're younger. They tend to be very active and feel very healthy, and they really kind of sometimes need to be prodded into seeing a physician and getting annual checkups. Usually they wait for some problem to arise before they see a doctor. So the thought of being part of a men's health program where you're seeing a doctor regularly, maybe it's every 2 or 3 years instead of every year, but at least that awareness that there are certain issues that can be identified early in a man's life, that are easily treated, that perhaps can prevent problems down the road, is a very important message to get to men.